When it comes to healthcare and medical advances, Central Florida is a place where a lot of those improvements are happening all the time. Now, one of those is new technology when it comes to arthroscopic procedures for your joints. In some cases, patients can walk out without any incisions. It's crazy. So how does that all work, and how can it get results for you? Bridget Ellison is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Encouraging because not only is this a newer technology, but having Dr. Vonda right here today to talk about it is very special because only roughly 6% of orthopedic surgeons are women. So as a sports medicine surgeon, you're really representing.
Well, thank you so much for having us here today, Bridget.
And this has just been, as technology evolves and you've been practicing, more and more people are able to get this surgery. Talk about the different types of arthroscopic surgery you do.
Absolutely. So I'm an orthopedic sports surgeon, so that means mainly I work on shoulders, hips, and knees in active people and athletes of all ages, just like we have here in Central Florida.
And right now you have a newer technology that's less invasive. Talk to us about the changes over the years with the tools you're able to use.
You know, those of you that have been around as long as I have may remember when our knee procedures came with very big incisions and took months to recover from. And in the last 30 years, we've been doing arthroscopic procedures through smaller incisions, less recovery time. But what we're talking about today with needle arthroscopy really is a game changer because I can do this procedure without a scalpel at all, without general anesthesia, without the need for opioid pain medications, and with extremely rapid recovery for my patients, which really that's what it's all about for them.
That's encouraging. So you're talking about shorter down times, less scars. I mean, it's a win-win.
Completely. And it's not only in knees, we're moving it to shoulders, to hips, even in trauma, we're using it to look at how the bones are arranged. But I wanted to show it to you.
Yes, you brought in an example of one of the tools.
So this is the size, if you can see it, of a typical arthroscopy camera, you know, the end of a pen.
Right.
But look, this is the needle scope.
Wow.
It's less than 1.9 millimeters. So I don't use an incision, I use points of entry. And so my patients walk out of the recovery room, they go home, they see me the next day, and they get back to the life they envision.
Wow, so what happens when that tool is inserted? How are you able to use it?
So this goes into a point of entry on one side of the knee if we're doing knee surgery. On the other side of the knee, I have little micro instruments where, for instance, if someone has a meniscus tear, which is really common, it's the disc in our knee that can get torn, it can pop and click and have severe pain and keep us off the activities. So by watching in a camera and watching on a screen like this, I use my little instrument to remove the damage, or in some cases fix the damage, and still with no general anesthesia, very little pain meds.
Wow.
I know, it's remarkable.
And so are they able to walk out, or they have to sort of, you know, stay off their feet for an amount of time?
No, in fact, I encourage people to resume their activities the next day.
Wow.
So that's why I see them a day and a half after their surgery, just to make sure everything's great and to encourage them, because it's a little bit different mindset to get going right away. And so people need that encouragement that it's okay.
And so what can you say to patients who think maybe I've got an issue and I need to look at surgery? No one wants to think about surgery, of course, or face it, but what can you say to encourage people to, you know, explore their options or maybe figure out if they have a need in that area?
You know, the first thing I want people to remember is that just because you have a tear doesn't necessarily mean you need surgery. You need a surgeon who will listen to you, listen to your goals, help you understand what your options are. Sometimes there are really great non-operative options, but when the decision is made to take care of the tear, you need to understand how fast is the recovery, what kind of incisions will be made, what it means to their lives. Because if you don't, what I find as a sports doctor is you slowly give up the things you love and you sit around and then you gain weight and then you feel terrible. So my opinion is that we need to fix you and give you back your life.
Okay, and you know, obviously that's priceless. I mean, you can't put a price on it, but let's talk about the price, because when you start talking about surgeries and insurance, or maybe if you don't have insurance, this type of procedure, is this, used across the board, or is this, a next level thing you have to really advocate for yourself to try to get this specific type of technology used on you? How does that work?
I just introduced this to Central Florida in partnership with UCF Lake Nona Hospital, and so that's where I do this procedure. The good news is that right now insurance is paying for it, so it's just like any other arthroscopy procedure.
And what's this one called, just so we're
This
specific?
is called a needle scope, a nano needle scope. So more and more doctors in this region will be interested in doing this. We've put out some videos on how to transition from a normal arthroscopic practice to a needle scope practice. And, orthopedic surgeons many of us are engineers or we're innovative, and so people are interested. But ask your doctor, do you do the needle scope procedure? Or call me. I'm happy to discuss it.
Well, this is wonderful information, Dr. Wright. We thank you for taking time out
pleasure.
to come in and tell us more about the nano needle and all the
Yes.
exciting things
It's
happening
really exciting.
with arthroscopy. Thank you.
My pleasure.